It's been really helpful in helping members just to hear a very quick overview of what the different issues are that encompass public health. And more importantly, I think also providing members an opportunity with individuals who are in Massachusetts who can be a resource as we think through both policy challenges and I'd say at a time in which we're really going to have to work hard to think about what are the levers that we have available to us at the state level to protect public health. I would say as chair of the Committee on Public Health, I have found the BU School of Public Health to be invaluable and accessible over the last several years. And it's just really helpful to have my colleagues also have the opportunity to build those relationships. We are trying to keep up with the overwhelming number of executive orders and cuts coming at the federal level and trying to understand where they will impact us in Massachusetts.
Historically, states have quite a lot of power over public health. This is part of the reason, though, that we talk about zip code dictating health, because each state treats public health and healthcare differently. This means that we have to think about how, when, and why states can act.
Communication is the engine for public health policy success, and it's not a mere afterthought. This is particularly important in today's infoscape, where misinformation can spread 6 times further and faster than the truth.
I want the Joint Committee on Public Health to recognize that these resources promoting shared services, promoting workforce training and capacity building are essential. And if they're not funded, I think a lot of trust in state public health will erode. As well as our public health institutions, including BU School of Public Health.
And today we talked to the Joint Committee about maternal health, and especially the landscape of maternal health in Massachusetts. And we really pushed how Massachusetts is the pioneer and how they can continue to support pregnant and postpartum mothers here in the state.
Half of maternal deaths that happen are preventable. And a whole bunch of those, a third of those, happen in the postpartum period, where there's a lot we can do to improve the way we serve pregnant people.
I think there's a lot of interest in the vaccines and the need for educating the public about sort of different vaccine preventable diseases and which ones are more lethal or more dangerous, so that they can prioritize those vaccines for their children, but also the need for greater education both by politicians, but also healthcare providers, so the general public has a better understanding of the importance of vaccines.
We find continued declines in cardiovascular disease mortality in other wealthy nations, whereas the cardiovascular disease mortality rates have largely stagnated in the United States. So with representatives today, we talked about that puzzle and some of the ways that we might tackle these challenges in the state of Massachusetts.
For trans people, gender-affirming care is primary care, and gender-affirming care saves lives. It's been demonstrated that when trans people get the services that they need, we reduce the likelihood of mental disease, substance abuse, and we improve mental overall health.